This one is tough because the incidence of it is so right in front of us. We see it rising every day. We have and we hear about it, and it's always shocking, and when you hear about it, and we've created almost sort of a reactionary way in which we're responding to it.
Mm-hmm.
But it's the prevention piece that I think we miss the opportunity to focus on, and that's something that we're doing here. And what I mean by that is, are we looking at situations where we're equipping our team members to really de-escalate in situations where we know, there's stress rising, there's agitation and psychosis with patients and families. Are we addressing it in a way that we're equipping them with the tools that they need in order to prevent these things from happening? And there's a lot of focus work, at least in my organization, I think nationally, that's happening in that space. And we need to continue to double down on that and create safe environments. The other thing is, I think we need to think about it a little bit differently. So in healthcare, we often focus on things that are traditional to the profession or the industry. And when you think about safety and safe workplace environments, there are other industries that are ahead of us on this. I think about the airline industry, for example. One of the safest places that I often find myself at, I feel, is in an airport. As I'm walking around terminals and getting ready, you feel safe in those environments because there's systems in place that have been intentionally worked on in order to support some of that. And I think we need to probably take a step back and perhaps even look into what other industries are doing. How are they creating and sort of maintaining safe environments? What are the tactics and tools that they're using to equip their team members with? And I think we could probably take a play out of some of those other playbooks as we think about how to create some improvement in this space.